I am the stone that the builder refused. I am the visual, the inspiration that made ladies sing the blues. I'm the spark that makes your idea bright. The same spark that lights the dark so that you can know your left from your right. I am the ballad in your box, the bullet in the gun, the inner glow that let you know to call your brother son. The story that just begun, the promise of what's to come. And I'ma remain a soldier till the war is won. Chop, chop, chop. Flip. Chop, chop, chop. Flip. Chop, chop, chop. Chop, chop, chop.
Oh, hey there. I'm Professor Harrison Vaughn from Harvard University here to talk to you about bronchitis. To start out, let me tell you what bronchitis actually is. By definition, bronchitis is an inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. People who have bronchitis often cough up thickened mucus, which can be discolored. Bronchitis also may be either acute or chronic. Often developing from a cold or other respiratory infection, acute bronchitis is very common. Chronic bronchitis, a more serious condition, is a constant irritation or inflammation of the lining of bronchial tubes, which is often caused due to smoking. Acute bronchitis usually improves within a few days without lasting effects, although you may continue to cough for weeks. However, if you have repeated bouts of bronchitis, you may have chronic bronchitis, which requires medical attention. Chronic bronchitis also is one of the conditions included in the chronic obstructive pulmonary disease. Moving on now to the symptoms of bronchitis. You may wonder, how can I tell if I'm getting bronchitis? Well, there's many different symptoms, which include coughing, production of mucus, which can be clear, white, yellowish gray, or green in color. It may also be streaked with blood. Fatigue, shortness of breath, slight fever and chills, and chest discomfort are other symptoms of bronchitis. If you have acute bronchitis, you may have a nagging cough that lingers for several weeks after the inflammation resolves. Chronic bronchitis is defined as a productive cough that lasts at least 3 months, with recurring bouts of 2 consecutive years. Now you may be thinking to yourself, well, when should I see a doctor? Well, the answer to that question is easy. If your symptoms are lasting for more than 3 weeks, definitely see a doctor. You should also see a doctor if your symptoms prevent you from sleeping, if your symptoms are accompanied by a fever higher than 104 degrees, if you produce discolored mucus, if you're producing blood, or if you're associated with wheezing or shortness of breath. But what causes bronchitis? Well, many different things could cause bronchitis. Acute bronchitis is usually caused by a virus, though. Typically the same viruses that cause the cold or the flu also cause bronchitis. And due to this, antibiotics don't kill viruses. So this type of medication is not useful in most cases. The most common cause of chronic bronchitis is smoking cigarettes. Air pollution, dust, or toxic gases in the environment can also contribute to chronic bronchitis. Now, if you want to get bronchitis, you should start picking up smoking or start getting exposed to irritants, because that's mainly what's going to get you bronchitis. There's also a few complications. Although a single episode of bronchitis usually isn't a cause or concern, it can lead to pneumonia in some people. Repeated bouts of bronchitis may include that you're developing chronic obstructive pulmonary disease. When you're preparing for a doctor's appointment, you should answer the following questions before you go in. Have you recently had the cold or the flu? Have you ever had pneumonia? Do you have any other medical conditions? What drugs and supplements do you take regularly? And are you exposed to lung irritants at your job? Going into a doctor's appointment with these questions already answered will help your doctor determine whether or not you do have bronchitis. Now, your doctor is most likely going to test you by using a stethoscope to listen closely to your lungs as you breathe. In some cases, your doctor may also suggest a chest x-ray, septum tests, or a pulmonary function test. There's a few different treatments for bronchitis, which could include antibiotics, although bronchitis usually is brought upon by a viral infection, so antibiotics usually are not effective. Cough medicine and other medications usually are used to treat bronchitis, along with therapies like pulmonary rehab and breathing programs with respiratory therapist teachers. Once again, avoid lung irritants, use a humidifier, and consider wearing a face mask outside if you want to prevent bronchitis. Get vaccinated for the flu as well, because the flu often causes bronchitis, and by getting vaccinated for the flu, you're also helping preventing your bronchitis. Another step to preventing bronchitis would be to wash your hands, because first of all, that's just disgusting if you don't, and second of all, it reduces your risk of catching viral infection. Well, I'm Professor Harrison Vaughn, and that's about all I have to talk to you today about bronchitis. Stay classy, North Andover.